Today we want to address one of the more serious topics that we discuss on this video series, and that's dentistry's role in overall total health. No denying it now, we've known this and thought about it for decades, but there are now hundreds and hundreds of studies by some of the top scientists and universities throughout the world that absolutely link the overall health that we have in our mouth to those other systems in our body. Such things as cardiovascular disease, hypertension, diabetes, arthritis. All of those things undeniably are related to the overall health that we have in our mouth. And I apologize in advance. I want to read a couple of things directly because they're so important. I don't want to misquote them. Charles Mayo, that most of us know, is a physician of the founding famous Mayo Clinic. Some of the top research in the world goes on there as far as our health and our bodies. I had this quote to say, and this was about 100 years ago: "The presence of dental health is vitally important to your overall health. Proper dental care and a healthy oral environment can extend human life 10 to 15 years. And we know that and believe it, and now it's been proven. Also, we want to talk about a quote that comes from Harvard University, one of the top universities in the world. And that study was conducted by a Dr. Robert Schmerling, who said, "In my 25-year career, one of the more surprising observations I've discovered in recent years is study after study have shown that people with poor oral health, such as gum disease, missing teeth, or bleeding gums, have a much higher rate of cardiovascular disease that includes strokes, heart attacks, etc., and other significant life-threatening diseases than those who have healthy mouths and have regular dental cleanings." Those are some very, very powerful statements, and we know those to be true. One of the most underdiagnosed things we've seen, and again, another sad statistic, and I want to quote this, and this is from the Oral Cancer Foundation, and they say, "Sadly, the death rate from oral cancers remain frustratingly high, around 43% 5 years after diagnosis." And I underline this. This is because so few cases are diagnosed early enough to allow doctors to treat the disease. Well, they have developed a new instrument that we use in dental offices called the Velscope. It's a very advanced instrument, but it allows us to simply, every year or two, detect cancer in your mouth, and it's very, very accurate. Very simple, inexpensive test. If you have any of the factors that lead to that, such as smoking, tobacco chewing, family history of cancer, we highly encourage you to get in to see your dentist or come see us at Merit Dental and get a Velscope exam. Very, very inexpensive and can save lives. Again, the most frustrating thing about oral cancer is it's easily treated. Unfortunately, it's not diagnosed until most of the time it's a little too late. So again, I just wanted to talk to you about those things and how overall health is affected. And one thing we didn't even talk about is pregnancy. And as you can imagine, overall oral health is critical to pregnancies and the proper development of your baby. So thanks for your time, and we look forward to seeing you in our office. Thank you so much.